Hi everyone, my name is Clarke. Welcome back to our Works YouTube channel. Today we are talking about double chin reduction. So we have our double chin. Where was Kybella 20 years ago when we all needed it? Double chin reduction is very important to the way we see ourselves and to the way others see us. And with this double chin, what is it? Why do we get that pocket under the chin? Well, I'll tell you, there's a certain amount of fat throughout the entire face. Some people have a little more, some people have less. That fat accumulates underneath the chin. So if you gain weight, sometimes it gets a little more full. If you lose weight, it can regress slightly. Other individuals, it doesn't matter how slim they are or how full they are, they're still going to have that double chin. So double chin have a very strong genetic component. You get this from your mom or your dad. Now, with the double chin reduction, this is what we want. We want a smooth, tapered, angled to the mandible and to the throat line. So we call this the cervical mandibular angle. And that angle is important because we view aesthetics as having a nice clean angle underneath our chin. So double chin reduction using Kybella again is one of the best things that has happened to us. Now, where's this fat? Where's this fat coming from? Where's this fat located? How deep is this fat? Well, I'll tell you, the fat is located just below the skin. And if you look here, you'll see that it's right almost like a triangular or diamond-shaped pattern, and it borders the mandibular edge, the submental crease, and the hyoid bone, which is just right here. And within those boundaries, that fat just sits there, accumulates there, and it sits under that chin. So we can remove that fat. There is, however, another component to this. In about 15% of individuals, there's a deeper fat pocket, which is much further back, and that's behind one of the muscles that we have on the neck itself. And that muscle is called the platysmal muscle. So initially, what we discussed was that fat pocket in front of that muscle. Now we have more residual fat behind the muscle. Targeting that area sometimes can also give much needed resolution to that double chin. Now, the procedure is done very, very easily. As long as we can mark out the area to be injected, the points, we use certain lines and angles to make sure that we are administering this drug equally throughout the double chin region. And with that, yes, we use a needle. A needle has to be used. However, you want to make sure that as an injector that you're not going too deep, but also as a patient, you stay really, really still because you don't want that needle going too far. However, it's unlikely to cause major issues. Now, let's talk about some complications that can occur from having double chin reduction using Kybella brand name or deoxycholic acid, which is the formulated name. So some of the complications would be damage to the nerve. If the medication goes a little higher up onto the mandibular nerve or the marginal mandibular nerve, it can cause some numbness that can persist for several months. However, in most cases, if not all, this resolves. Other small complications, actually not really complications, but they're more like side effects that are very transient, they wouldn't last that long, is the pain, some swelling, some redness. And this is due to the procedure itself. So what are we going to look at after the treatment is done? Well, directly after the treatment, you're going to have sensitivity and discomfort underneath the chin region in any area that was injected because the acid is actually destroying the fat cells underneath. As these fat cells are being destroyed, they release their inner contents. And so your body sends a lot of fluid into that region to try to take it away because we are destroying the fat permanently. The swelling that occurs after this treatment is considerable. So you have kind of like a frog neck. It really gets much larger and it doesn't look that much better until maybe 2 to 3 weeks later. That's very important to know. If you have a wedding or you have a special engagement to go to, don't do your Kybella injections within a month prior. Let's talk about the pain and sensitivity that can occur after the injections. So during your injection, during your treatment, you're going to have multiple pokes from the needle under the neck. This can range from 40 pokes to 50 pokes, but there are quite a bit of needle injections you will experience. That gives you the initial discomfort from the needles. After the procedure is done, you're going to have ice that you can calm the area, but you're going to have more of a dull sensation that continues for several days. Now, I've had patients where the pain continued up to about 7 days, other patients up to about 14 days, but it's more of a dull, consistent, even pain that reduces in intensity as time goes on. Now, let's discuss cost. Cost is very variable. It depends on where you go. It depends on the practice. There's so many factors that can determine the cost. However, I've heard cost around $400 up to $1,500 per treatment. Now remember, you get what you pay for. So you should always be in that sweet spot when it comes to cost doing any medical or aesthetic procedures. Meaning, you don't want to be too low and you don't want to be too high. You kind of want to be in the middle after you do your research on what practices charge. This is very, very important. Now, there's no need to spend $1,500 to $2,000 for a Kybella procedure, and you really don't want to spend $400. Again, you get what you pay for. After your initial treatment, expect to have at least 2 more. These treatments are done 3 times. 1 month apart. So you start in January, it's January, February, and March, you will have your treatment done. So say you're preparing for the springtime, you really want to start January or February. You don't want any residual swelling from the procedure itself. Of note, some individuals, after 2 sessions, they're quite fine. Other individuals may need 4 sessions. However, the average is 3 sessions. Now, who is the best candidate for Kybella injections and who is not necessarily the best candidate? This all has to do with the laxity and the firmness of the skin. My cutoff when it comes to double chain reduction is around the 35 to 40 mark. At this point, your skin doesn't want to bounce back after being stretched for a considerable amount of time. If your skin is slightly looser, if you have slight lines within the skin that shows the age of the neck and the skin under the neck, you're not necessarily going to be the best candidate for Kybella or double chain reduction injections. Why is that? The fat under the neck is actually pushing the skin out and keeping it smoother. So if your skin is already loose and you have the reduction of fat done, then you will definitely get a turkey neck. You will definitely get a lot more looseness and waddling on the neck itself. Some individuals need that fat. Other individuals don't. The best time to do this treatment is really 21 up to about 35. After that, there's a possibility that your skin will not retract after the treatment is done. Now, what is my alternative? What is a patient's alternative if they're over 40, 45, and they can't have their Kybella injections? That alternative is going to be 2 things: surgery or threads. Now, surgery is a bit of a gamble. You're replacing their protrusion with a scar if you pull the skin. If you do liposuction, which is using a surgical cannula to suck that fat out, there are more complications that can occur. And that may not be the best case scenario because you're also removing the fat and causing loose skin. Now, if you do have looser skin or saggier skin under the neck, your next best option will be threads. Using dermal PDO threads to pull the skin laterally and up to relieve that angle caused by the protrusion of the double chin. With this, you can sometimes carve or sculpt the type of chin and jawline you would like. So to some degree, this may be a better option. I have had patients where I had to remove the fat first and then do my thread lifting to really create a sharp jawline after the fat was removed, and if they had sagging of the skin on the neck afterwards. So guys, that was it for double chin reduction using Kybella. This was Diamond Works YouTube channel. For any additional questions or comments, leave them below. Don't forget to subscribe. There's so much information waiting at your fingertips.